Audio recording for this meeting has begun.
Right. Hello, everyone, and welcome to our second webinar in the fiscal year 2022 National Program Integrity Webinar Series. My name is Leanne Bryant, and I'm going to get us kicked off here today by providing just a bit of background for today's webinar. As many of you on this attendee list likely know, the 2022-2024 Ccdf plans have a section, Section 8, on ensuring grantee program integrity and accountability. So a high-level summary there. This section of the plan asks state and territory lead agencies to identify and describe effective internal controls to ensure integrity and accountability, processes to investigate and recover fraudulent payments, and processes to impose sanctions in response to fraud. This section also asks state and territories to describe the results of several program integrity activities. So today's presentation is intended to get you all thinking about identifying, measuring, and communicating the results of your program's program integrity activities. Some logistics before we jump into the agenda. We do encourage interaction throughout the webinar, and in order to do that, please feel free to use the chat pods to ask questions and share information with one another. That chat pod is at the bottom of your screen. We are going to take frequent breaks to address any questions that might come in and to discuss any of the more pressing topics that might come up in the chat box. Due to the large number of attendees today, everyone is currently muted. But again, to communicate, interact with your peers and presenters, please use that chat box. In the Program Integrity Resources pod, the lower right of your screen, there are some resources available for download, including the handout of today's slides. So please feel free to download throughout today's presentation as you wish. Heidi Freimiller is our tech support person on today's call. You'll see Heidi's contact information in that chat pod at the bottom of the screen. If you happen to run into any issues, you can chat with Heidi there, or you can send her an email. Finally, we also want to alert everyone that we do have closed captioning available for today's session. If you are in need of closed captioning, you should see at the very top of your screen a CC with a little drop down where you can toggle that on. You can turn on closed captioning if you need it. The National Center on Subsidy Innovation and Accountability has a dedicated team of program integrity and fiscal subject matter experts. This group here is very passionate about Ccdf program integrity and fiscal accountability, researching and identifying effective internal controls, and in turn, in coordination with the Office of Child Care, sharing our findings and offering support to all of you. That's me on the left, Leanne Bryant, and I'm calling in from just outside of Harrisburg, Pennsylvania. Shannon Masaraco is from Rhode Island and our Fiscal Management and Accountability SME. Janae Williams is joining us from her home in Louisiana, and Mike McKenzie is calling in from Wisconsin. Shannon, Janae, and Mike will all be presenting this afternoon and helping to demystify this process of communicating results of your program integrity activities. Now for a welcome message from the Office of Child Care. I'm going to turn it over to the Director of the Division of Oversight and Accountability, Toya Bryant. Toya?
Thank you, Leanne, and good afternoon, everyone. I would like to welcome you on behalf of OCC to our second webinar, as Leanne shared, as a part of the 2022 National Program Integrity Webinar Series. I would like to acknowledge our central office points or leads on the line, Alinda Winings and Adi Fatur, as well as any regional staff from OCC's federal offices that we have on the line. As Leanne shared, these webinars are part of OCC's ongoing work to support states, territories, and tribes to strengthen their program integrity and accountability efforts and minimize the risk of waste, fraud, and abuse. And as stewards of public funds, lead agencies have a responsibility to ensure that CCDF program integrity, safeguards, maximize benefits for eligible children, families, and that tax dollars are spent appropriately. Again, as Leah shared, today we will be discussing strategies for using available program data to measure, describe, and communicate the results of your program integrity activities. We are so excited to have the Vermont Department for Children and Families Child Development Division to share information about how they ensure program integrity in their Child Care Financial Assistance Program. These webinars are an opportunity for you to hear from your peers and learn how this work is implemented on the ground. And we want to thank states who have participated on these webinars in the past and encourage you to reach out to us if you have practices or strategies you would like to share. We definitely value your ongoing participation, and we have found from the field and use your feedback to help us select topics for these webinars and other TA materials. So please continue to share your ideas about what you would like to see in the future. And now I will turn it back over to Leanne.
Great, thanks so much, Toya. All right, let's move on to the agenda. Here's what we plan to cover this afternoon. We're going to start with Mike. He's going to walk us through some CCDF program integrity related requirements and lead agency responsibilities. Then he'll start us off on some discussions on how to identify what program integrity activities to report. Shannon will present on ways to measure success, including data collection and evaluation. Janae will then share strategies for communicating the results of your activities. And I do want to mention that throughout each of these sections, the team does have several examples to share with all of you. Our state presenter today is Vermont's Ann Rada, and will help us to tie it all together, highlighting Vermont strategies to identify, measure, and report program integrity results. And then we'll finish up with a wrap-up and next steps. Now I'm going to turn it over to Mike.
All right, thank you very much, Leanne. Good afternoon, everyone, and thank you so much for tuning into our webinar today. We want to start out with the federal regulations and lead agency responsibilities related to program integrity, just like Leanne mentioned. So let's start out with 98.68 sub A. This points out lead agency responsibilities and requirements to ensure integrity and accountability. Minimizing fraud and risk requires consistent follow-up. We can set up fraud prevention steps and reporting procedures to identify risk, but if we don't follow through by looking into reports or suspicious actions, then we're really defeating our own security. Section 98.68 sub B speaks to lead agency responsibilities to describe in your state plan the processes in place to identify fraud or other program violations. These activities include record matching, review of attendance and billing records, supervisory or quality assurance reviews, and staff training, whether it's providers or clients or the general public. Now, as stewards of the program, lead agencies agree to comply with CCDF regulations, define policies and processes for their agency in their state or territory or tribe, and submit a plan for operation to OCC every 3 years, which most folks just did recently. This plan describes how your program is administered, and we all know that amendments may occasionally be required, but it's best to check with your regional office about how and when to approach those amendments. Like I mentioned just a minute ago, agencies submitted new plans last year for federal fiscal year 22 through 24. And there's additional plan requirement language in the regs at 98.10 and 98.14. CCDF plan sections include outreach and consumer ed, providing stable child care financial assistance to families, ensuring equal access, establishing standards for monitoring processes, recruiting and retaining a qualified and effective workforce, supporting continuous quality improvement, and last but not least, ensuring grantee program integrity and accountability. And that's what we're going to focus on today. Now, throughout the presentation today, when we are referring to the CCDF plan questions, we're really talking about the state territory plan specifically. We realize that tribal CCDF plan questions are a little different, but the concepts we're talking about may be useful for all programs. Within the CCDF plan preprint, you're asked to include description of the results of some of your program integrity activities. Identifying and communicating the results of your activities can assist in training needs and policy development for your agency. Also informs your administration and legislature of the positive impact of program integrity. It instills confidence in the general public that their tax dollars are being protected. And it provides OCC with crucial data to improve program operations nationwide. Our presentation today will really focus on the parts of Section 8 of the state plan requesting that state agencies or that agencies include descriptions of the results of their program integrity activities. So those include 8.1.5 related to activities that identify and prevent fraud. 8.1.6 related to activities agencies use to investigate and recover improper payments. And 8.1.7 related to sanctions for intentional program violations by clients or by providers. So let's start off by discussing how to identify what program integrity activities to report. The clues can be found in your CCDF plan preprint. I plan to kind of set the stage and provide an overview. We're going to break down the plan into easier digestible parts and drill down into results. So I hope you find this helpful. Like the title of the presentation says, we want to help you identify, measure, and communicate the results of your program integrity activities. So we're going to start with 8.1.5. And this tells the agencies to report the processes they have in place to identify fraud and other program violations to ensure program integrity. This part of the plan asks you to describe what you have in place for match data, like new hire, Social Security Administration, Paris, which we're going to talk a little bit more about, red flag reports, whether they're in your system or you do it manually, QA or supervisory reviews, and there's a lot of good info, I believe, here. Like how many reviews are you doing? What did you find? What did you do with it? And then finally, training for staff, providers, clients. Did it target or reduce errors that you have found? So those are the type of things you can describe in this section of your plan. Okay, we're going to provide some state examples today. These may be excerpts or paraphrase so that the whole answer may not be included in some cases, but you'll get the gist of it. One of the questions in 8.1.5 refers to reports agencies have developed in their system to help maintain program integrity. So here's an example from one state. And I've broken their response into 2 slides so that you can see the description of their activity here. And they talk about the red flags being developed to analyze data from clients and providers. And then they give some examples both of client red flag reports and provider red flag reports. Some really good examples here. This slide represents the results from investigations that were conducted from the hits the lead agency received from their red flag reports. So you can see here they have provided information on total improper payment claims established for provider overpayments as well as client intentional program violations. Another useful match that you can avail yourself of is the Public Assistance Reporting Information System, or PARIS. Now, all states participate in PARIS for at least the Medicaid program. You're required to participate once a year. The match is available quarterly for child care, TANF, Medicaid, and SNAP. You can contact the PARIS administrative representative in your state if you're interested in child care information, and if you want to work with them to submit one input file for processing. It's not required, but a lot of times what I have seen is that states coordinate the file that they send in. I've also provided the state PARIS contact on this link for you in case you're interested in seeing who that is. If you need more information, you can contact your regional office and we will provide you with the information you need. PARIS is more likely to provide hits when adjacent states are participating. So in my opinion, the more states in the PARIS system, the more effective it becomes. You can use the link from the previous slide to check to see what other states use PARIS if you're interested. One other point from my perspective using the match when I was the fraud manager in Wisconsin is that you can really zero in on the information you need by reviewing and identifying the elements of the match file you want to send and receive, such as certain program payments or programs that you want to report for. So here's an example from one state's use of the match for Ccdf. And you can see here they've indicated in the quarter of report they had 145 matches. Of the 145 matches, the lead agency received 72 responses from other states, resulting in 10 referrals for fraud investigation. Good example of reporting those results from their activities. All right, let's move on to 8.1.6. This is where you have the opportunity to identify and recover misspent funds and describe that activity resulting from fraud. And as we know, you also have the option to recover any misspent funds as a result of errors, depending on what your policy is. So here's an opportunity to talk about how much you collected for each activity, whether it's repayment plan, tax intercept, reducing benefits for future months. You can identify what time period that was for. Did this result in any investigations? If so, how many investigations and what were the results? And finally, in this section, you also have an opportunity to talk about what makes your fraud unit so effective. Now again, we pulled data from current state plan submittals. Everyone has this kind of data. You just need to figure out where to find it and how to use this information to improve your program. Don't make this simply an exercise in providing the data because it's required. This is a great opportunity to use data that you have within your program to improve your program. And so you can see in this example, this agency talked about collection revenue for repayment plans, tax intercepts, and lien and levy. And of the amount that was the claims established, then it gives you an idea of how much was recovered versus their Department of Revenue as well. Here's an excellent example, in my opinion, of describing an agency's program integrity unit, their activity, and their results. The lead agency has described what their fraud unit is. They've talked about the number of referrals received and the results from working those referrals. Very thorough, comprehensive response here. Give you just a minute to take a look at that. And again, down below here in our program integrity resources, you'll see a number of resources available for you, including a copy of today's slide deck. So you will have this information for reference if you're interested. All right, moving on to 8.1.7. This is the final section of the plan that we will cover today. This delves into what type of sanctions the lead agency places on clients and providers to help reduce improper payments. And so here's your opportunity to discuss your activity and results around parent sanctions, provider sanctions, possible cost savings from these actions, and if you pursue prosecution or not as well. Here's one state example describing their activities and results related to 8.1.7 sub C related to prosecutions. You can see 8 cases were referred to the Attorney General's office in this case. Of those 8 cases, they ended up with 1 conviction, 2 currently pending prosecution, and 5 cases that were declined prosecution. I found this example interesting in that the agency described how their process works for client fraud. And even though the agency had no clients disqualified, as you can see in the last sentence of this example, they still tracked and reported their results. Sometimes you're not going to have any activity, but you can still track it and you can still report it out. So think of information that could be helpful to improving your program and track it. You can report it when your state plan is due, but you can also use this data to improve your Ccdf program throughout the year and perhaps other program assistance programs as well. This is just the kind of information that allows you to meet the requirements of your Ccdf state plan and also improve your program. So here's a couple examples of claims established, whether it's the amount of claims established or the type of claim that you've established, improper payments, whether they were recovered or not. You can talk about how much in claims were established versus how much was collected. Number of intentional program violations, both for parents and for providers. And it may be an opportunity for you to establish some type of program savings as well. This could be derived monthly or annually using an established methodology from your state. All right, so I've provided my take on how to identify what to report for your program integrity activities, but we would love to hear from you now. So here's what we're interested in. We'd love to hear from anybody as far as what your agency tracks, something that we haven't described. And if you can share with us something that hasn't been described so far, why do you track that data? And additionally, we're interested in whether or not you have any stakeholders that are interested in this information. And if so, who are they and why are they interested in this information? So we're going to give you a few minutes to give us a couple responses. Again, whether it's collection methods, fraud activities, we'd love to hear from you in terms of things that you're doing that maybe I have not mentioned so far. I'm sure your peers would love to hear that as well. Maybe it's the number of referrals that you have received. Tell us about your fraud unit or your stakeholders. Who's interested in this information in your agency? All right, we're going to give everybody just one more minute here. Love to hear about something that an agency is tracking that we haven't thought about. And if so, why do you track the data? What's in it for you? All right, folks, if you think of anything later, you can certainly still insert it. Folks would love to hear about what activities you were doing and why you do it. So feel free to enter that in the pod or in your evaluation after if you don't get a chance to come back to this. At this point, I want to turn the presentation over to Shannon Masaraco for a discussion about how to go about measuring your program integrity activities. I want to thank you for participating again today. And Shannon, I'm going to turn it over to you.
Thank you, Mike. Okay, so let's get into measuring your success. Measuring success to report results is a Ccdf plan requirement, but it also provides unique information to your program and equips your lead agency with the ability to make data-informed decisions. Some key benefits are insights, trends that can lead to more proactive versus reactive process improvement opportunities, cost savings, maximizing program funds, and it demonstrates due diligence that in turn leads to building public trust and stakeholder buy-in, and overall just better serves your community. I love this quote. If you don't pay appropriate attention to what has your attention, it will take more of your attention than it deserves. Nice little brain twist. So for me, it speaks to our attention constantly being called to the many competing priorities and daily demands. Now more than ever, we live in a world where most of our distractions are at arm's length. In a former role as a state administrator, I had to make a conscious effort to prioritize my attention. I knew investing my attention in developing metrics and committing to reviewing our data would save me in the long run and prove fruitful. This practice of being intentional with my attention allowed me to get ahead of program needs versus always having to be reactive to them. One example of this was a report of number of cases facing negative action by reason or type. I was able to catch an uptick of cases and was able to shield those cases to not be closed until we got additional information to confirm they were appropriate, versus causing unnecessary disruption to families and providers that usually equates to an influx of complaints in the lobby and on the phone, and then you're not really servicing those who are coming in for regular day-to-day needs. So data often gets ignored because the process feels overwhelming. It doesn't have to be, though. In fact, let's put your administrative data and leverage data to use. We'll begin by mapping out the process into a few simple steps. So, getting organized. Define your program integrity goals and objectives. This ensures the right questions are being asked to demonstrate program impact and progress. Next, data collection focuses on what data is required to answer the questions and identify systems and processes to collect said data. Data analysis applies the data to the goals and objectives and provides program outcomes and insights on trends and also reliability of the data. Data evaluation, this identifies opportunities to fine-tune the data needs and determine if additional data is needed to better serve your program and to communicate your progress. Ensure you work with your regional office to amend your state plan with any new goals and objectives that you develop. This is important to get the credit for the work your lead agency is doing. So moving into data collection. Again, this focuses on what data is required and the systems and processes to collect the required data. So start at the source, your program integrity metrics. Evaluate your metrics to identify data components. Is the data currently available, or is this going to be a new data request? Where will the data come from? Is it internal, within a division, unit of your agency, or is it external, like a CC, R&R, or a subcontractor? Or, as Mike was discussing earlier, maybe it's Paris. Do you need a formal or informal data use agreement or memorandum of understanding? Consider aligning the frequency as much as possible to obtain a bigger picture for the said point in time that you're reporting on. How is the data tracked or collected? Is it automated? Is it manual? What type of data are you looking for? And what's your plan to get the data that you don't currently have? And I just want to point out the program integrity tip on the slide about data use agreements, what they should include. But what I really want to point out on this is it's a good practice to summarize informal agreements via email for documentation purposes. It never hurts just to confirm to make sure everything said in verbal is confirmed and nothing was left out. Moving on to data analysis, and this is where we apply the data to the metrics. Okay, now you have all this data. What are you going to do with it? I like the acronym KISS, but I kind of redefined it a little bit. Keep it simple, but significant. So remember, data analysis doesn't have to be complicated just for it to be meaningful. We provided some key tips over here to organize your data files, develop a master spreadsheet with a tab for each metric, customizing each tab with relevant fields. Remember to show trends over time. You will need a date field. And then document your approach to ensure it's systematic, consistent, and promotes continuity. I'm going to pause here for a second to give everyone a few, some time to read the information on the slide. So we saw this example earlier in the deck when we were discussing identifying activities to report. But it is also a great example of measuring success. It identifies sources and amounts of claims. I also want to point out the charts provided on this slide and the next slide are not state created. However, we wanted to share how you could use your data to create visualizations. As time progresses and additional data is tracked, along with any pertinent policy operational changes, this chart could be switched to a bar chart with the trend line to show progress over time, noting the policy and operational changes to document their impact. So the results examples over here, it lays out the activities relating to the red flag reports, and the results is the lead agency was able to identify the overpayments for providers, for clients, and for for providers, and then overpayments and intentional violations, and then claims established for the client's IPVs. This example demonstrates two sets of results. Past due claims, a total of 6,887, and then of that, 6,368 belong to client and 519 to providers. In fiscal year 2020, and showing improvement in fiscal year 2021, with a total of 6,451 claims, of that 6,031 were related to clients and 420 related to providers. And then in the next chart, we have overpayments, a total of 80 overpayments in fiscal year 2020. Again, for demonstration purposes, we broke that data down into quarters so that you can see the hypothetical quarter-to-quarter comparison and then the year-to-date cumulative count. And in quarter one of fiscal year 2021, a total of 20 overpayments. So again, giving a quick little pause to give everybody a chance to read the information on the slide. In this example, the lead agency demonstrates results based on their program integrity processes that include the use of interfaces with other programs as an external verification of client-provided data. I also wonder if anyone else sees the potential to create additional measures based on the information provided. Feel free to type those in the chat box if you see any other ways to collect additional data for this measure. Perhaps create a reporting mechanism for staff to know every time they identify a discrepancy, and when that results in a decrease of benefits, and if feasible, record the savings, is one way that I've identified. Next. This example, the lead agency is describing their tiered and collaborative collections process that they noted an uptick of recovered funds. Again, I wonder if anyone has any thoughts on how we could tease out some additional metrics within this information provided. What I noticed is perhaps documenting total claim amount and amount recovered at each tier of the process. That way you can see the volume of recovered funds at each step of the process. And finally, but not least, data evaluation is an opportunity to see what has or is working well, identify areas to fine-tune data needs and processes, and determine if additional data is needed to better serve your program and to communicate your progress. Consider amending your state plan to reflect any new metrics to ensure you get credit for the work your lead agency is doing, and you can do so by reaching out to your regional office. All right, folks, so let's talk about it. What do your lead agency's data collection efforts look like? And what are some methods or tools your lead agency uses to analyze data? So for the collection efforts, do you have analytical teams? Do you have a data, a dedicated team that works on collecting the data? And for your methods or tools, do you have any tips or tricks when using Excel, or do you have any tools that are integrated with your system that work well for you? Come on, I know other people on this call are equally excited about data as I am. We're a quiet crew today. And if you don't have tools, what tools do you wish you had? I also want to take this time to remind folks that anything that we're covering today that you think is useful information and you want more assistance with, please reach out to your regional office to request technical assistance. So thank you, Alicia. Your data collection is very manual. Is it all interagency, or is it also external data that you're manually collecting as well? And Kim Miller, we start billing evaluations with reports from our data warehouse. Nice. Can you tell us a little more about your data warehouse, Kim? All right, Ruby. Our agency is under our tribe's PL 102-477 plan, and they do all the data collecting using a program from TribeView. I think they're out of Oklahoma. Several of our programs use it. Nice, thanks for sharing. I also want to point out when states or lead agencies, I meant to say lead agencies, when you guys share your approaches or your thoughts or your ideas, it really does help your peers and it's greatly appreciated. And then Kim also added compliance units within the subsidy services section, collect and analyze data, okay? And on the other side, Alicia, Mass does pull reports from our financial system to analyze billing and caseload, okay? So when you pull those reports from your financial system, do you use like Power BI or, oh gosh, I just forgot the name of the other one. There's another dashboard tool that completely escaped my mind. And Kim uses, very good. So Alicia does use Power BI. And the other one I was thinking of was Tableau, is another data tool. It's more for visualizations, but it's also a good dashboard tool. And Kim Miller, lots of manual processes here too. All right, so compliance units within the subsidy services section collect data, collect and analyze data, okay. And then Roman also said that they use Power BI. Okay, well that's great information. I want to thank everybody for your time today and for sharing. Like I said, this information is really useful for everybody that's on the call and for anybody who listens to the future recorded webinar. So thank you so much. And up next, I'm going to turn it over to my colleague, Janae Williams, on communicating results. Thank you, everyone.
All right, thank you, Shannon. Thank you very much. Let's go ahead and get started here. We'll talk about communicating the results of your program integrity activities. After I go over this, we'll turn it over to the state presenter from Vermont. So you've identified, we've talked about identifying your administrative data, collecting and evaluating that data, and conducting an analysis. Now let's discuss just a little bit more about communicating the results. Now, before communicating the results, an agency should identify their audience and the purpose of communicating the results. Just remember who and why. Who is this for and why do they need it? The reason why the agency wants to identify their audience is that your audience dictates the why of the results, and sometimes vice versa. The why dictates the who. The type of audience can be either internal staff, supervisors, management, leadership, boards, etc., or external legislators, community partners, the general public, and other stakeholders. Identifying the audience gives the results of PI activities purpose. While you may want everyone to know about your commitment to fraud and the results of your program integrity activity, providing information on a specific activity such as an internal control activity, it may not be suitable for a board, may only be suitable, for a board or federal agency. Disclosing that same information to providers or parents may not be beneficial. However, on the other hand, showing the number of referrals or disqualifications as part of your PI training to providers and or parents could be used as a fraud deterrent mechanism. So let's look at a few purpose-driven statements and or expected outcomes or goals of communicating PI activities and results. On the screen, there are some purpose-driven statements and expected outcomes for internal and external audiences. For internal purposes, communicating the results of your program integrity activities can assist the agency in identifying goals or next steps. Maybe your data shows that your front-end staff need retraining on identifying altered documentation and the verification process, or the data shows that your internal control for a specific activity in place is not working so well. Communicating results can provide for the agency measured progression or degression of a PI activity, and it can also be used as a performance measurement or accountability mechanism for departments, units, or staff. In addition, the results can assist in the enforcement efforts and ensure that everyone is on the same page and working in tandem towards the same agency goal. Now, on the other hand, with the external audience, the agency can build trust through accountability and transparency. For example, providing information on how the agency is appropriately spending funds or administering the Ccdf program. Showing the results can formulate outside partnerships, enabling citizens to advocate for additional child care investments with confidence, as well as other partnerships with groups that advocate for more funding or policy reforms. Now, we all know that there is a lot of Ccdf administrative data that can be communicated, so knowing your audience helps guide the type of results you want to communicate. All right, so thinking about communicating the results of PI activity, we must remember that it has two parts, right? There's the activity and the result. When communicating the activity, the agency is merely providing a description of the program integrity activity. In this example on your screen, compliments of GAO, the lead agency indicates their activity is the collection and analysis of provider and client data to produce red flag reports. The second part, the results, is the actual outcome that has been observed in relation to the activity described. Here, the lead agency states that they were able to establish a total of 360,586 provider overpayments because of IPVs, and they also listed the client overpayments for IPVs. Now, I know that we've looked at a few examples of communicating the results of the CCDF plan, but we'll look at a couple of more here. Now, but before I get into the example to the right, let's call the graphic on the left the FAB 5 of communicating program integrity results: findings, outcomes, results, answers, and conclusions. The three to the left of the pole are controlled. The lead agency controls the information being distributed, controlled but not manipulated, and the two to the right are the uncontrolled parts of the FAB 5, but they are guided. With your controlled parts of the FAB 5, you have the findings, which include all of your data evaluation, and then your outcomes, your data analysis, and then your results. The FAB 5 uncontrolled but guided parts are the answers. Your audience gains purposeful information or is provided an answer to a specific question, and then conclusions. The audience draws their own conclusion based on the results provided. Let's move over to the example to the right, which is an example for the CCDF plan. In the example, we see detailed information related to the agency's program integrity activity of randomly selecting 12% of their providers and reviewing their billing and attendance records. Now, from this activity, the agency also provides for fiscal year 21 the number of attendance billing records they reviewed, which was 565, the number that turned into formal investigations, and then the outcomes of those investigations. All right, so here's another example of how the agency could communicate PI activity and the results in the CCDF plan. Here the agency provided the PI activity, which is the fraud hotline, and then they provided the results. The details of the results are guided by the intended audience. The agency was very specific in the results to ensure all appropriate information was captured to answer the question in the CCDF plan. The results have purpose with an intended communication goal. Through the use of the fraud hotline, the agency was able to identify and investigate possible fraud. To communicate their results, the agency provides to the audience the number of cases they investigated, the number of claims they established, and how much was ordered in restitution. They even took it a step further and proactively separated provider and client claims. Now let's look at a few more visuals which outline specific data for specific audiences. Now, many of you, if not all, already use graphs and charts to communicate results, and we wanted to point out how those same activities can be used to communicate program integrity results internally and externally. Graphs, pie charts, and columns are what I consider a universal public administration communication, mainly because of their simplicity, meaning they're sometimes easier for the audience to digest and easier to present on, especially to people who are more visual learners of information, or when you have only a limited amount of time to provide information. Visuals allow the agency to communicate very specific data. In this example, the lead agency program integrity manager wanted to show leadership that the new process of second-level case reviews conducted by the QA staff has allowed them to locate more program violations among clients and providers. Maybe there was a question on whether there was still a need for the QA staff to continue to conduct those second-level case reviews, or the manager was using it for performance measurement. The takeaway is that the communication has two parts, the activity and the results. And it can also draw upon the FAB 5, findings, outcomes, results, answers, and draw conclusions. Let's take another look at a visual. In this example, the recovery unit supervisor wanted to review the recovery methods to see if there were changes needed to the process for an upcoming management meeting. Here the information is condensed, right? The unit supervisor and managers can evaluate their current practices based on the data provided. From here, management and supervisors can have a purposeful discussion. For example, if they outsource any of these activities or practices, they could conduct a cost-benefit analysis or a cost-effectiveness analysis, or both may be in order. Notice how the examples have historical data, include historical data. Comparing historical data to the most recent data is a great way to look at the effectiveness of your PI activity. And also, historical data can also show the norms and point out any abnormal activity. Let's look at one final example here. In this last example, the lead agency is displaying some fiscal information on their website to share with the general public. Instead of having large monetary numbers, the fiscal director thought it better to show percentages with a reference list for our audience. One of what I think is the beautiful things about visual data is that it can be done so with confidence, because you have all of the administrative data to back the results that you're displaying. And in some cases, it's a better way to catch the audience attention and help them to understand the information being provided. So let's talk a bit here about the benefits of communicating results. So there are many benefits to identifying and communicating program integrity activities and their results. Some of those benefits include being able to pinpoint training needs and policy revisions and continue development, program development. In addition, results can inform administration and legislators of the positive impact that PI activities have on your program. It also instills, by communicating those results, it instills public confidence that their tax dollars are being protected. And of course, lastly, and certainly not least, it provides OCC with crucial data to improve program operations nationwide. So before I turn it over to our state presenter from the great state of Vermont, we would like to give you all a moment to share with each other one last time here. In the chat boxes, please answer the following two questions. Does your agency have a monthly or quarterly report that is used to measure performance? If so, please share, tell us about it. Or has your agency made a process change not related to COVID or regulatory requirement as a result of the outcome of a performance measurement conducted? And we'll give you guys a few minutes here to share with one another. And I see we have Alicia Wells is typing something in the chat box for us. And I know it's kind of hard to think past COVID right now, but we can certainly try. Or maybe your agency, maybe there's something that you do internally just with your staff as far as performance measurements. Supervisory case reviews or payment reviews. Has your agency posted any information regarding the use of Ccdf funds on your website? We'll give it a few more moments. I see that we have a few people typing here in the chat box, eager to share with one another. A few more seconds here. All right, Kim Miller. We knew we were not evaluating enough providers with consultants, so we've added a 5th consultant. Awesome. So obviously Kim Miller, I forget, what state again? I don't want to say the wrong state. North Carolina. Thanks. Thank you. Conducted a performance measurement to see how the evaluation of providers were being conducted and how it was being conducted. And from the results, they added a 5th consultant. Ruby says our program does reporting on an annual basis for the PL 102-477 fiscal reports. I evaluate my staff on a quarterly basis as far as their performance on their job goes. And that's actually something we use, and I see this across the states actually, the performance measurements internally where agencies set goals and actually have those quarterly check-ins with staff to go over what the current goals are, you know, and where staff needs improvement or where they're doing great. Marilyn here completes the 1st and 2nd level reviews of the work authorized by the vendor. Great job. And we also complete monthly service level reviews of the vendor. That's beautiful. All right. So I think we will have these comments available for you guys when it's posted to the YouTube channel, but in the interest of time, and I know that you all have came here to hear from your peer, I will now turn it over to Ann Rada, and I hope I said that right, Child Care Benefits Administrator, Vermont Child Development Division. And the floor is yours.
Thank you, and good afternoon, everyone. I'm here to share a few slides about Vermont's Child Care Financial Program Assistance, Program Integrity work, essentially. So the goal of Vermont's Program Integrity team is to ensure that Child Care Financial Assistance Program eligibility determinations are made correctly and families meet federal and state eligibility requirements. We do shorten Child Care Financial Assistance Program to CCFAP, so I will probably be using that moving forward. Our goal is also to ensure that child care provider payments are correct and no fraudulent billing has occurred, and that information submitted by a client is valid. The Program Integrity team in the state of Vermont is a unique one because we not only rely on internal state staff, but on our community partners. The unit consists of me, the Child Care Benefits Administrator, 2 CCFAP grant monitors, 1 quality control specialist, formerly known as our Program Integrity Investigator, and 1 financial specialist who handles everything payroll related. So helping us in this program integrity process are the 36 community child care agency eligibility specialists that are contracted with the state of Vermont to determine eligibility for subsidy families. And not included on this slide, because I forgot them originally, and they should have been, is the team of child care licensors that visit providers annually. They're another set of eyes for us on the attendance sheets located at the program, and they can compare these to the hours that the provider submits in our data system, and they will let us know if anything looks unusual. As we go through the rest of the slides, you'll be able to see how each of the people listed here are directly involved in Vermont's program integrity work. So the Child Care Financial Assistance Program utilizes a web-based integrated data system called Bright Futures Information System, or BFIS. BFIS was built to do the following: determine child care financial assistance eligibility for families, license and register child care providers, and maintain the program's quality status and staff credentials. We use it to pay child care providers on the family's behalf through weekly payroll runs. And it has a system that shares and matches data from other programs such as economic services, family services, and the Office of Child Support. So the system also contains a consumer concern queue which tracks licensing investigations, client eligibility or payment complaints, and potential payment fraud investigations. The general public, state staff, community partners, they all have the ability to post a concern into the system, and these are transferred to a queue that the Child Care Financial Assistance Program and Child Care Licensing Unit manages. And finally, we can use the investigative data from the complaint queue if an investigation leads to expiration of a provider's license or disenrolling a client from subsidy. This integrated system provides us the best tool that we have in our work with program integrity. Although we have different permission levels for the system, state staff in the Child Care Financial Assistance Program, the licensing unit, and the operations unit can see the subsidy client's eligibility status, we can see provider invoices, and we can see the attendance that providers submit for the children. The ability to compare all of this information when processing payroll or for licensing when they do a provider visit has proved to be invaluable in determining if fraud has occurred. So let's move on to provider payment integrity. So when a provider submits an invoice, it goes through a two-step approval process in our system. During this process, 10 to 15% of the total number of invoices submitted receive a secondary screening of authorized child care hours versus attendance hours. And we can also look at providers that seem to have consistently high subsidy payments, and we will give those a second look as well, especially for our registered home providers when we know that that amount seems very different from what we've seen previously. So although we pay in 2-week service periods, which begins on a Sunday and ends on a Saturday, we run a payroll weekly. So each week we are looking at 10 to 15% of the total number of invoices submitted. So we keep a spreadsheet of the providers that receive a second look, and we'll list anything that may require additional scrutiny. So it is a spreadsheet that tells us, who we looked at, what the problem may have been if there was one, or if it was just everything looked clean. We do this so that we're not always looking at the same providers. We want to make sure that at some point every provider gets a secondary look of their invoices. So attendance and payment data is aggregated into program reports after the payroll runs by our system, by BFIS, and these are regularly reviewed to detect anything that warrants further investigation. Our system will also generate reports related to enrollment of subsidized children at or above licensed capacity, and it will also tell us which children have multiple providers. If long-term fraud is suspected, attendance records are requested or picked up from the child care provider, and the quality control specialist compares these records with the information in BFIS. If fraud is found, the provider will be placed on a repayment plan. In addition to this, BFIS was built with a standalone recoupment page where we can enter large recoupments into BFIS and set the percentage to be taken from each new invoice submitted by the provider. We do this because really the goal of our provider program integrity is to recoup the money that the provider should not have received, but not put the provider out of business. And if the amount is large and we take it all at once, it could destabilize that provider. So therefore, when we're doing all of this provider payment integrity, we spend an equal amount of time between verifying that no fraud occurred and training providers on how to bill correctly. So now let's move to agency program integrity. So Vermont contracts with 12 community child care support agencies to determine child care financial assistance eligibility for families. These agencies are spread out throughout Vermont, located in the 12 regions of Vermont, and these agencies are monitored through the following processes. So we do have performance-based contracts which specify the quality and accuracy of eligibility determination activities that's required by the Child Care Financial Assistance Program. Data is pulled from case reviews and BFIS to determine if performance measures are met, and we will implement a corrective action plan if needed. The performance measures in the contracts include the following. They must maintain an 8% maximum improper payment rating, and we can get this information from the case reviews that are done by the grant monitor. 80% of child care financial assistance applications are initiated within 7 business days of receipt, and this information can be pulled from BFIS. And 80% of application eligibility is determined, or the application is closed within 30 days of initial receipt of application. So these performance measures are built right into the contract, and we monitor these agencies on all of these performance measures. And to determine if the agencies meet these requirements, the grant monitors conduct agency visits to ensure that the eligibility specialists are doing their job correctly. And they do this by auditing individual client files and comparing the documents received to what is entered into BFIS. The state is solely responsible for training these eligibility specialists. So although they are not our employees, they are the agency's employees, we conduct all of their training, and we, do regional meetings and yearly meetings as well with them. We want to ensure that each eligibility specialist is receiving the same information and are utilizing the same policies throughout the state of Vermont. So that is why we control the training that occurs with them. And then finally, eligibility specialists are required to complete a case file checklist form for every application submitted. This form ensures that all required documentation is in the file and the information is accurate. Let's move on to client program integrity. So with client program integrity, we utilize many methods to ensure that the information provided by the client is correct. We do have the data bridge between BFIS and the Economic Services Database, which provides income information to BFIS daily. Eligibility specialists can access this information to verify documentation provided by the client. So it essentially gives us a secondary look at the paperwork that the client sends to us on income, child support, etc. Agency eligibility specialists are trained on identification of fraud and potential program violations of eligibility, and emphasis is placed on identifying incomplete or incorrect information, comparing previous documentation, and utilizing the ESD inquiry to verify information. Audits are conducted on 10 to 15 files per agency per month, with an emphasis placed on eligibility percentage, authorized child care hours, and attendance hours of the child. If errors are found in how eligibility is determined, the grant monitor will conduct additional training with the eligibility specialist. In 2018, we switched to auditing new files as they come in so that we can correct issues immediately. This was a really good switch for us and for the clients, because we were able to identify things as they came in, which allowed us to correctly give to clients what they were eligible for. And it obviously helped with our program integrity numbers. In cases of program violation by a client, the eligibility specialist and grant monitor meets with the parent to verify the eligibility information. If fraud is suspected, the file is referred to the quality control specialist for investigation. A repayment plan may be established with the client to recover the overpayment. If the improper payment is significant, the client will be removed from the subsidy program and cannot apply again until the recoupment is paid in full. This one we went back and forth on because, some people felt that they should no longer be allowed to come back into the program. However, we determined that we do have some clients that, it truly benefits them to utilize child care for their child to be in child care. And if they make a good faith effort to repay what they owe us, then we do allow them to reapply. And we've had several cases where clients have come back on. They are told that we will, continue to monitor every time they submit an application. It'll go through a secondary review, so they know that we are watching them at all times. But it has worked for the clients in our program. So I will say that our biggest client fraud case to date totaled $86,000. It was prosecuted. The client was found guilty and is currently on a repayment plan, although I think I'll be long retired before we actually collect all that money. So let's move on to how did we get here? So in 2005, the Bright Futures Information System was launched. This new integrated system allowed us to pull data reports directly from the system. It took what was a paper-based justification process where providers were mailed attendance sheets to complete and send back, and turned it into a completely automated payroll process. In 2011, the Child Care Financial Assistance Program was given a Program Integrity Investigator. Though we were given the investigator in 2011, full investigations with recoupments didn't begin until early 2013. And I'll just say that's when I took over. The focus prior to shifting was on provider training to ensure that they did not continue to improperly bill, but we didn't bother to go back to try and figure out what they actually owed us. So in 2013, when the focus shifted to utilizing the reports from BFIS and comparing this data to on-site provider attendance sheets, in the first 2 years alone, we recouped $249,000. Now, I will say that after seeing some of the numbers on these slides, that doesn't look like a lot of money. But what you have to understand is Vermont is a small state. We serve approximately 6,000 families, and we have about 1,100 providers, give or take. So for us, $249,000 in 2 years was a significant recoupment project. So in 2012, a provider training handbook was developed. The emphasis in this handbook was on correct billing procedures and policies related to eligibility. They have a step-by-step process with slides that show them how to bill properly in the system. Each provider is given this handbook. The child care licensing unit actually carries them with them, and if a provider says that they will be taking subsidy children into their program, they're given the provider handbook at that time. In 2013, a child care policy and procedure training manual was developed. We did this to put all policies and procedures in one manual that eligibility specialists can access when determining eligibility. Each agency has a copy, and it's the grant monitor's responsibility to update the manual when and if it's needed. During this time, we also started using the Vermont Tax Offset Program. We submit names to that on a yearly basis. We have received some money back, but it's not as much as we would like, although I am thrilled to report that we just received a $1,900 payment from a client who owes us a fairly significant amount of money. So we'll continue to utilize that program. And let's see, then in 2014, an electronic case file audit form was developed. This changed us from a paper-based audit form to an electronic form, which transferred all information into one spreadsheet. This increased our on-site case review audits done by the grant monitors by 25%. So it really meant that we were looking at a lot more files and making sure that the eligibility determination was done correctly, and providing training to those eligibility specialists that seemed to be struggling with the process. And then in 2015, we created a case file checklist form. This form must be completed on every application that is submitted by a client. It's done by the eligibility specialist, so as they go through what is submitted, they need to check it off on the form, and the form also tells them what to look for in each document. This is not a thing that the eligibility specialists enjoy doing, and it is a requirement that it be in the file, but we credit this form and the electronic case file review form for dropping our improper payment rate from 7.6% to 2.8%. So, we will continue to use these forms because they obviously have a big effect on our program integrity. So then in 2016, we updated policies and procedures to reflect the new federal rules, and there were a lot of them. When we did this, we also developed new policies for payment issues and program integrity that eligibility specialists can refer to when they see a potential issue in the paperwork or with attendance. And the policy gives them a step-by-step guidance on what they should be looking for and what to submit to us. And then in 2019, a Child Care Financial Assistance Payment Processing Manual was developed. Prior to 2019, a new financial specialist would receive one-on-one training on payroll invoicing, manual checks, adjustments, and recoupments. We knew that all of this information needed to be put in writing and documented step by step. This led to a development of an internal manual that is so detailed, most people can step in and help with the process if needed. All right, so why do we do this? So why do we do this? Well, the first thing is to comply with the state plan requirements, OCC monitoring, and the improper payment process, essentially Section 8 of the state plan. To provide data and information to senior management on current fraud activity and results of closed investigations. A lot of this information is also given to the legislators so that they can understand how the program is going and essentially what we look at when we are determining eligibility. To determine additional training requirements for agency personnel and child care providers, and to determine what procedures are needed internally to help improve billing processes for child care programs and the eligibility application process for clients. So what's next? So this is probably the most exciting thing for us, and what is the biggest amount of work that I am currently doing. So we are currently building a new integrated data system, and everything that we have developed for program integrity will help to inform how the system is built. The first phase of the build is eligibility and provider payment, and the second will be the reporting module. We're looking at all the reports that we generate from our current system and are determining what needs to change. In addition, we're looking at what additional reports we need in this new system, and that will allow us to further integrate program integrity directly into the eligibility and payment process. One item that is being developed is a case-specific audit form, which will allow the grant monitors to complete the form in the system under the client's case. We will have the ability to pull this information into a report that gives us all the information needed for our current performance measures. Another thing that we are adding is the ability to reject an invoice that's been submitted by a provider, which we know is incomplete or incorrect. If an invoice is rejected, an email is immediately sent to the provider, which contains information on what the problem is and how it needs to be corrected. This sounds as though it would be something that providers wouldn't like. However, we did vet this process through a team of child care providers that are acting as our advisory and testing team, and they were thrilled about it. So one of their biggest complaints in our current system is that they have to wait until their invoice goes through both payment queues before they can fix it, or they have to wait to hear from us when we start to conduct an investigation on why their billing looks unusual. So with this, we can reject the invoice, send it back to them, let them know what is wrong with it, and they can either explain why why the billing looks that way, or they can go ahead and correct the invoice and resubmit. And then finally, all documentation submitted by subsidy clients will be electronically uploaded into the system. This will allow the grant monitors to complete case file audits without having to visit the agency. With less travel, they'll be able to increase the number of file reviews conducted each month. And it'll also allow the payroll processing team to immediately verify the client's hours and days needed for child care with the attendance submitted by the provider. As each of the modules of the system is built, I think we will continue to determine what data is needed from the system to help us ensure the program integrity of the Child Care Financial Assistance Program. It's, you know, although BFIS is a great system for us and gives us a lot of what we do need, it's a very old system and unstable. And having the opportunity to build a new system and kind of launch our next phase of program integrity is exciting to all of us. So that's where Vermont is right now. I am more than willing to answer questions. If you would like my email address so that you can email me directly if you'd like to see some of our forms, that's fine as well. Program integrity is probably what I like best about this job. So I'm always willing to speak with anyone in other states or provide the documentation that we have on what we do. So thank you, everyone.
Thank you so much, Ann. Wonderful presentation. It's always so helpful to get a lead agency's perspective on this and the practical application of all these things we talk about. So we're going to take just a couple of minutes. We're short on time, folks, but and there were a couple questions in the chat box already. If you have any more, feel free to plug them in here. If we don't have a chance to answer your question today, we will follow up. I can guarantee you that. So, and Teresa Bledsoe asked if you can share the case file checklist form.
Absolutely. If you'd like, I can actually send it to you, Mike, and if you want to share it out, that's fine.
Yeah,
or
yeah. Let's do that. Let's do that.
Yep, I will.
Great.
In the next couple of days, I'll pull that together and I'll get it to you.
Thank you so much. Let's see. Leanne just made a comment about completing the audit form in the system. How amazing that sounds. Connie asked about the case file checklist also, so that's a popular item that you brought up. Teresa wondered what format the new system is in.
So it's being built on the Salesforce platform. The developer is called Bright System, which I find interesting considering our other program is Bright Futures, but this Bright is B-R-I-T-E. And they actually had a system that did a lot of this kind of payment work already. So they are custom building the eligibility portion so that it speaks directly with the payment piece of it. So it's kind of interesting because it's a combination of something that's already in place while we're also modifying it to include eligibility. And then from there, it will be building this in modules. So after this piece, which was eligibility, payment, and the reporting, we'll move to the child licensing and then our quality control. We want to continue to have an integrated system, which is, you know, why we're building it on the Salesforce platform. And Bright will be taking this from beginning to end. And it's called CDDIS, so Child Development Division Information System.
Great, thank you, Ann. There's a couple of other questions that have come in, but for the sake of time, we will follow up on these questions, but just want to go through the last few slides and get you folks out of here on time. In terms of useful resources, we've just listed some resources on this slide. that you may find useful to support your program integrity activities: the fraud toolkit, some information on reporting, the Grantee internal control self-assessment instrument. The NICSIA landing page for program integrity resources will provide you lots of stuff, folks. It's kind of your one-stop shop for good information there. And then the Office of Child Care COVID-19 resources as well. As we wrap up today's webinar, please take a few minutes to complete the evaluation that will come up at the conclusion here. If you have any outstanding questions or comments you haven't had the chance to share, enter them in the evaluation form and we will follow up and make sure that we get back to you. Remember that technical assistance is just a phone call away, so reach out to your regional office if you'd like some help or additional information on anything that we covered today. Our next webinar is tentatively scheduled for June 14th from 3 to 4:30 Eastern Time, just like today. Announcements will follow as the webinar approaches and as we firm up our date and time. And so with that, I just want to say thank you. Have a great day. See you next time. Please take a couple minutes and fill out the evaluation. Thank you, everybody.